So, good evening, friends. Today we are here to celebrate the World Heart Day from the Swastisukham Care Foundation and the team. Myself, Director Archna Gupta, welcome you all with the Dietitian Bharat Gandhi from Gujarat, Ahmedabad. And today we are discussing about the how we can reverse the CAD. And you must be knowing this idea from where it came. So the idea for this annual event celebrating the World Heart Day came from the annual event that was conceived by Anthony Baez de Luna, president of WHF from 1997 to 1999. World Heart Day was originally until 2011 observed on the last Sunday of the September, with the first celebration taking place on September 24, 2000. So cardiovascular disease are the most common cause of the death globally, that you all are knowing कि दिल जो हमारा है बहुत ही important है और बहुत ज्यादा जो बीमारियां हमें पता ही नहीं चलती हैं कब वो हमारे दिल का आघात या दिल का दौरा पड़ जाना, इसके थ्रू अचानक से डेथ हो जाती है लोगों की। और क्योंकि हम अपने दिल को सोचते हैं तो धड़क रहा है बढ़िया से, तो इसके बारे में क्या सोच, है ना। लेकिन दिल एक ऐसी जगह है अगर जिसको आप ध्यान ना दें, आप अपने आप को मानसिक तनाव में रखें या खान पान ठीक ना रखें या आपकी लाइफस्टाइल ठीक ना हो, तो इस तरह की कोई भी चीज अगर आपके साथ होती है तो आपको दिल का दौरा पड़ सकता है या हार्ट डिसीज के आप कल्पित हो सकते हैं। तो दिस इज अ डिसीज वेयर यू कैन मैनेज योर हार्ट इन अ प्रॉपर वे इफ यू लाइक। तो आज हमारे संग भरत गांधी जी हैं। भरत जी, बहुत बहुत स्वागत है आपका, जो पिछले कई सालों से अहमदाबाद में प्रैक्टिस कर रहे हैं। और आज हमें सूरत। ओके ओके ओके, आई वाज कंफ्यूज। हाँ, तो गुजरात तो मैंने ठीक ही बोला, अहमदाबाद में थोड़ा सा हो गई कंफ्यूज। सूरत से आज हमारे साथ भरत भाई हैं। और सूरत जैसा की बात आपको पता है कि डायमंड इंडस्ट्री के लिए जाना जाता है, इसी तरह से जो हमारा दिल भी है अगर हीरा हो तो फिर क्या ही बात है। तो भरत जी, ओवर टू यू एंड आप हमें थोड़ी सी रोशनी डालें CAD, हाउ टू रिवर्स द CAD। जी,
should I start now?
Yes, yes.
Archna, should I start?
हाँ जी, हाँ जी, हाँ जी भरत।
Hello everybody and Archna madam. As per your information, we are starting a seminar on this World Heart Day regarding coronary artery disease. Everybody knows that coronary artery disease is a very fatal and it affects all age group of the people. And whenever previously there was much more death due to communicable disease, but nowadays due to stress, competition, fast life and bad lifestyle habits, deaths are much more common in due to this coronary artery disease. It is estimated that 12 million deaths are being done due to this CAD. So as far as the CAD is concerned, first we should know what is CAD. Our heart pumps average 4 to 5 liters of blood to blood and other organ in a minute. So you can know that how much costly is this pump. If you go in the market and purchase a pump of 20-30,000, it will last for 10 or 15 years. But this pump lasts for at least 75 to 100 years. Yes. So we should evaluate the cost of our heart and we should maintain it and take care of this heart. As we age, it is natural that our arteries and blood vessels become tough and non-elastic. So there will be some deposition of lipids, fats, and it will narrow the blood vessel. So blood supply to the heart and other organ will be restricted. So there will develop in the vessels one plaque. Plaque means some obstruction is there. So blood supply will be difficult and thereby one may develop this coronary artery disease. And as I previously told that approximately 12 million deaths are due to this coronary artery disease. So we should take care of this coronary artery disease. And care should be taken from the teenage, because we should not wait that we develop this coronary artery disease. So we should start taking care from the teenage, because teenage is the right age to take care. Now, let us look at the world statistics for this coronary artery disease. In the worldwide, 3.8 million people and men and 3.4 million women are suffering from coronary artery disease. And in India, it is almost same. Out of 1,050 men and 52.5 women are suffering from this coronary artery disease. Archna, next slide. Slide next.
I have shared next. आप बोलिए टाइप ऑफ सीएडी मैंने नेक्स्ट कर दिया है, बोलिए.
Okay, sure. Now, as far as coronary artery disease is concerned, there are three types of coronary artery disease: obstructive, non-obstructive, and microvascular. Obstructive means some narrowing, and some obstruction means plaque is there in the vessels, and non-obstructive means the arteries and veins are not functioning properly. In microvascular, it means arteries and veins are not properly providing supply to blood and other organs. Next. There are four types of main arteries: right coronary artery, left main coronary arteries, left anterior descending artery, and left circumflex arteries. Next. Now we are going to discuss these causes of the coronary artery disease. There are two types of causes are there. One is modifiable, which are in our control, and second one is non-modifiable. As far as modifiable factors are there, we can modify it or we can control, and we have some control over there. And in modifiable factors, first is diabetes. In diabetes, blood circulation is diminished and arteries become thickened and non-elastic. So there is chances that you may develop heart disease. Second one is hypertension, blood pressure. So in blood pressure, atherosclerosis is there, and heart has to function much more fast, so it will have some heart disease. Third factor is obesity. In obesity, it can lead to diabetes, hypertension, other failure of the organ. So obesity should be controlled. Fourth one is food habits. In nowadays, fast food, rich food, fatty foods habits is there. So it should be controlled. And one more thing, some people have high lipid content in their blood, mainly triglyceride, cholesterol triglyceride. So if triglyceride is high, then it will deposit our arteries and veins, and it will develop the heart disease. And one more factor, cigarette smoking, alcohol. Cigarette smoking may damage your heart. And one more factor, lack of physical. Nowadays, everybody is having competition, stress, and fast lifestyle. So for physical activity, they don't have time, and it will lead to heart disease. And last, non-modified is stress and anxiety factor. Everybody is facing competition, so anxiety and anger factor it affects definitely our hearts. Next slide. As far as non-modifiable, which I previously mentioned, age. You cannot change your age because you are going to increase your age. So as far as aging process is there, atherosclerosis will be developed, but we can control it. We can have some modification of lifestyle, and we can keep ourselves away from this CAD. Male and female. Sometimes gender is also equally responsible. Race, as far as black and white, black people are much more prone to CAD, white people are some less. And last, non-modified family history. If family history is there of heart disease, then person is supposed to probability is much more for heart disease. So it is better to take care from the teenage so that he may not develop heart disease. Next. Now, basics for reversal. I am running this program. I have learned from Archna, you have told some scientist name. So in America and every country, nowadays, alternate therapies importance is there. One program named Universal Healing in India, Heart Healing, and for this coronary artery cyst. So basics for reversal is basics is this. Okay, first of all, to regress the plaque in our arteries and veins, some plaque is there. So it is our goal to regress. Regress means to diminish the size of the plaques. That it will lead much more blood circulation to our heart and organ, so it will not damage our heart. Second thing, to dilate our blood vessels by some many means are there, which I will discuss later. So if you dilate our vessels, then blood supply to our heart will be increased, and thereby it will not damage the heart. And third one, if you are, most of the cardiac patients are overweight, diabetic, hypertensive. So if you are overweight, make it your weight ideal as per your height. And fourth one, make lifestyle as per healthy lifestyle and food habits. So as far as food habit is concerned, prefer low fat diet, low carbohydrate, and especially avoid simple carbohydrate and complex carbohydrate prefer. And high protein diet. High protein diet will increase your muscle mass, and thereby it will increase calorie consumption. So it will lead some weight reductions. And high fiber diet. High fiber diet will lead some calorie curtail. So it will lead some healthy weight management. And last but not least, low sodium diet, because sodium content will be affect kidney and heart both. So you should prefer sodium content as low as possible, and prefer fresh fruits and vegetables as per permissible limit. So you will have much more calorie, vitamins, minerals, fibers. And avoid tobacco and alcohol, because tobacco, what it do, alcohol, tobacco, cigarette smoking, mawa, it will develop free radicals in your body. Free radical will ultimately damage your arteries and veins. So it will, next slide, it will damage your arteries and veins, and early atherosclerosis will develop. So you are supposed to avoid addiction. And one more thing, always you have must have, मैं कौन हूँ ऐसा लोग बोलते हैं, ये है ना सत्ता वाले लोग, पैसे वाले. तो इसमें क्या रहता है, एंगर, ईगो है, वो अल्टीमेटली कैन लीड टू हार्ट डिसीज. तो ये छोड़ देना चाहिए. और रोल ऑफ मेडिटेशन. If you do meditation, it will give release of good hormones, and it has definitely some improvement in your heart condition. And our goal is to take these all precautions, and thereby, if you cannot reverse, but at least new plaque will not be formed, and present plaque will be regress. So it will definitely help you. And as far as reversal program is concerned, it takes long time. It is not a time period which can get of 3 or 4 months. It is a minimum 6 months requirement. And get rid of this who am I, make on any, and comfortable living. Next slide. Now, reversal program is much more important for diet. Your diet should be balanced diet. It should contain protein, fat, carbohydrate, vitamins, minerals, fibers, everything in a balanced proportion. If you are overweight, then your diet should be 20 calories per kilogram per body weight, so that every month at least you should reduce your weight by 1.5 to 2 kg per month. And as far as calorie distribution is concerned, you should consume 20% of your total calorie from fat, and that too fat from not saturated and trans fat, but it should be polyunsaturated fat and PUFA and monounsaturated fat. They are healthy fat, and they help to improve your health. And 30% from protein. Protein help to reduce your weight, and it gives muscle mass. It gives help to build up muscle mass. So if you build up muscle mass, calorie consumption will be much more, and it will help to reduce your weight. And 50% from the carbohydrate. Carbohydrate should be preferred from complex carbohydrate, not simple, because complex carbohydrate will digest slowly. It will not give rise to sugar level. So prefer complex carbohydrate, whole grains and fruits and everything. Don't prefer this simple carbohydrate, jam, jelly, murabba, cold drinks. And like this pastry and everything is banned. Next. And prefer seasonal fruits. All the seasonal fruits, they help to develop healthy heart. Next. Being a dietitian, we are supposed to educate our patient. This is not treatment science. We are just like one teacher. We make them aware that you should take this thing in this much quantity and this, avoid this much. So you should feel guilty if you are taking some heavy or high fat food. So we are getting patient aware of the calorie and quality of the food. And as far as sodium content is concerned, I have told that some food item with namak, soda khar, papad khar, garam masala, pav bhaji masala, Chinese and tin pack item, they are much more dangerous for this heart patient. Next. If you take this precaution, then mortality rate will be reduced. And as far as if you have exercise portion in your day-to-day life, your collateral circulation. Collateral circulation, what it mean by, if you walk a day 30 to 40 minutes, your circulation system will develop parallel, just like roads. Some roads is blocked. So many administration will start some bypass the road. Just like that, our body will also automatically develop new arteries and venues in your body, and it will compensate this blood circulation which have some plaque. So collateral circulation develop only by aerobic exercise. In aerobic exercise, walking, jogging, swimming, cycling, rock climbing, dance, everything is there where heart rate and lungs rates are increased. Heart rate, normal our heart rate is 72 per minute, 70 to 72. But in this type of aerobic activity, it may reach up to 80, 90, depends on the intensity of the exercise. And respiration rate. Respiration rate is normal, our respiration is 15 to 16 per minute. But if you go for this type of aerobic activity, you could develop up to 18, 19 or 20 per minute respiration rate. It will lead some benefit to your heart. And one should walk for at least 30 to 40 minutes for sedentary and active life person, and 60 minutes for sedentary life person. Next. Now, by diet management and collateral circulation, we can, it is said that if you develop collateral circulation, it is a natural bypass, which we are going to have at a surgical operation. If you go for it, now I have 4 or 5 patients for this type of under my cure, and all the 4 patients are, since last 1.5 years, they are under my care, and they have developed their 2D echo is improved, their ejection factor is improved, and their cardiologist ask them, what are you doing? Result is much more good. So it is nothing but a natural bypass. Now, as far as lipids, plaque is formed in the blood vessel, so one should aware of the cholesterol, lipid factor. So how much lipid should be maintained? Your cholesterol level, though it is said that 200 milligram is adequate, but one should maintain below 180 cholesterol. HDL is protecting cholesterol. So one should keep their HDL cholesterol up to 45 because HDL is protecting cholesterol. It is in the myocardial layer of the heart. So to improve it, some omega-3 fatty acid substance like almond, walnut are to be taken. And triglyceride, it is much more risky factors. Triglyceride should be kept in between 120, 130. So your lipid level is low, there are chances that you may not develop plaque. And plaque, if you reduce your weight and lipid level, then plaque will be regressed. And by having patience, you can have some good life. Next. And if you may, just I told you that you should, calorie distribution should be from 25% for protein. Protein increase will give you, make much more muscle mass, and thereby weight management will be helpful. And now coming to next, in pranayama yogasana. Actually, it is an ancient science of thousands of years old. Pranayam, normal, our respiration is shallow respiration. We are not deep breathing. During pranayam, we are supposed to take deep breaths. Either in aerobic exercise or in pranayam, we are supposed to take deep breath. So during deep breath, oxygen is supplied to heart as well as other organ, and so it will rejuvenate our organs and heart, and it will improve your heart strength and reduce the stress level, and it also eradicate the free radicals. Yogasan like Bhastrika, Yog Mudra, Sitkari, it will also make your heart healthy and your body make elastic and much more healthy. So pranayam will also reduce middle obesity and make your heart much more healthy. Over and above pranayam, yogasana will improve ejection factor. It will definitely help your, but you should have patience, because diet, exercise, pranayam, yogasana, and last but not least, but also do take your medication as per your doctor advice. But if you go for this discipline, you will definitely have benefit, and some of this may regress the plaque and will have a normal life. Now, specific for food for the coronary artery disease. Some doctors advise vasodilator drugs, nitrate preparation. So there are so many foods which are nitrate containing foods which can give blood supply, which can make blood supply more to heart. This type of beetroot, pomegranate, spinach, berries, pumpkin seeds, sunflower seed, garlic, and carrot. These foods can definitely help, but it should be finalized by the dietitians how much quantity, and depending on the associated disease with other these. And some herbs are also helpful for these things. Herbs like ginger, cilantro, saffron, lemongrass, cumin seeds, cinnamon, and sweet basils, cardamom, ginseng, and others are also helpful to for this blood supply to increase in our heart. As I inform you that improving your lifestyle, diet, exercise, pranayam, yogasana, meditations, and get free from anger and leave your addiction, you can have a good healthy life, and you can reverse your heart disease with easily. Thank you.
थैंक यू वेरी मच भरत भाई. आपने बिल्कुल सही बताया कि हम ये कह सकते हैं कि डाइटरी मॉडिफिकेशन के साथ साथ लाइफस्टाइल मॉडिफिकेशन अगर हम करें तो डेफिनेटली हम अपनी कार्डियक जो डिसीज है उसे हम इम्प्रूव कर सकते हैं. राइट, यही कहना चाह रहे हैं हम सर. लोगों को हम यही संदेश पहुंचाना चाह रहे हैं कि आपकी जो भी फूड हैबिट्स हैं उनमें आप चेंजेस लाएं, और उसके हिसाब से थोड़े थोड़े चेंजेस जो हैं आपको इम्प्रूव कर पाएंगे. और साथ में अगर आप प्राणायाम, योगा, एक्सरसाइजेस भी करते हैं तो सोने पर सुहागा है. बिल्कुल है ना? बिल्कुल बिल्कुल. तो हम लोग बीइंग अ डाइटिशियन हम लोग इसी चीज पर काम कर रहे हैं, एंड मोस्ट ऑफ अस आर टेकिंग केयर ऑफ द पेशेंट्स अलोंग विद द डाइटरी मॉडिफिकेशन एंड द लाइफस्टाइल मॉडिफिकेशन, स्पेशली एक्सरसाइजेस, योगा एंड द मेडिटेशन. एंड विद द स्वास्थ्य केयर फाउंडेशन वी आर आल्सो इनटू इट. एंड हम लोग रेगुलरली भरत भाई सुबह और शाम हमारी मॉर्निंग योगा क्लासेस ऑनलाइन भी होती हैं और मेडिटेशन प्रोग्राम्स भी हम लोगों के होते हैं. तो वी आर वर्किंग ऑन दैट आल्सो. थैंक यू वेरी मच भरत भाई, एंड कीप कनेक्टिंग everybody. Take care of your heart and be healthy always.
Thank you. Bye.